Hello, this is Ford Brewer with PrevMed, heart attack, stroke, and cancer prevention. Why worry about cures for these awful diseases when you can prevent them in the first place? Love to hear your thoughts. Please respond, comment on the sections below. Today we're talking about another test. It's the last in a series of tests for inflammation. We're basically talking about the Cleveland Heart Lab's cardiovascular inflammation panel. We have talked already about myeloperoxidase, which some people call the Joker, plaque 2, and microalbumin creatinine ratio, which are by far the two most important of the inflammation tests. We talked about HSCRP, or high sensitivity C-reactive protein, which is not a very specific test. And now we're going to round it off with talking about F2 isoprostanes. Now, when I was examined by Bradley, he asked me about that and said F2 isoprostanes, to him, he considers to be the lifestyle lie detector test. And again, Bradley's the fellow that wrote this book, How to Beat the Heart Attack Gene. Wrote it with Amy Doneen. He's been doing a lot of this type of heart attack and stroke prevention for a long time. Now, if you look up F2 isoprostane on some of the academic journals, you'll see, yes, you start with diet and exercise and other lifestyle factors. You get oxidative stress. That oxidative stress then can result in impact on creation of isoprostanes. Then you get into COX-2 impact on isoprostanes, and we'll talk about that. We've heard about that in another video on thromboxane. Remember aspirin, the Aspirin Works test to see if aspirin is actually helping. Thromboxane is one of the prostacyclins that causes platelets to aggregate. So let's go back though and talk about what are these two materials. Thromboxane and F2 isoprostane do seem to be related, and yes, they are. If you go to Wikipedia, you'll see that isoprostane is listed as a prostaglandin. Well, what is a prostaglandin? What's it sound like? Prostate gland. That's actually where it was discovered. When they discovered it, they thought it was unique to the prostate gland. Since then, however, they have discovered that almost all cells or all tissues of the body make prostaglandins, and there are several different types, some of which we'll discuss today. But what are prostaglandins? Again, if you go to Wikipedia for prostaglandins, they'll say it's a physiologically active lipid. Well, let me translate that. Physiologically active means it's actually hormone-like. It has properties where the ones we're talking about today will, F2 isoprostanes will result in inflammation. They result in vasoconstriction. Some of the other prostacyclins, for example, will result in vasodilation. Thromboxane, as we discussed the other day, another one of these prostaglandins, actually causes platelets to be stickier and increases the risk for clotting. That's why we look at Aspirin Works to see if there's a lot of thromboxane in the urine. For those of you who are biochemically oriented, these prostaglandins are made from fat molecules. That's what it meant when it said it was a lipid in Wikipedia. All of them have 20 carbons. They start with a 5-carbon ring. Again, for the organic chemists, basically you take one of the fatty acid chains out of the 3, and then you add a 5-carbon ring. And that's where you get that. Now, let's get to F2 isoprostane, and let's start basically, let's just talk about oxidation real quick. A refresher. You remember oxidation it's what makes iron rust. It's what makes our blood turn red when we breathe in and we oxidize the iron in our hemoglobin. It's what causes an apple to turn brown as it gets old. It causes degenerative disease, or it's what's happening with degenerative diseases such as diabetes, Alzheimer's, rheumatoid arthritis, and heart disease. In other words, you've got an oxidation process resulting in inflammation in the artery walls. Now, what has that got to do with F2 isoprostane? So, let's go back. Poor diet, poor exercise result in oxidation. And guess what? Then we have an impact on a molecule called AA, or arachidonic acid. And again, you may remember arachidonic acid was the precursor for thromboxane, which is the molecule that makes platelets thick or sticky, and that we look for in the urine with the aspirin works test. It also impacts prostacyclins. Prostacyclins actually do sort of the opposite of thromboxane and prostaglandins. They cause vasodilation. Then you get the prostaglandins, like F2 isoprostane, and it's a marker for inflammation. So again, that's why we look for F2 isoprostane in the standard CHL Cleveland Heart Lab inflammation panel. Another headline here: isoprostanes is a novel biomarker for type 2 diabetes. It's a review article, and basically what it's going into is the concept for those of us with full-blown type 2 diabetes, as well as those with significant insulin resistance, you have significant oxidation going on in the arteries. That's, again, what drives heart attack and stroke for that majority of us that have insulin resistance once we're 65 or older. So, we want to make sure that your lifestyle is good, and we can check for that. Thank you.